one time, okay? So that's a newer thing we're doing with Actos. We're the only one in the country who's doing that. So I know that's a whirlwind about Actos. We'll have Q&A time at the end. Let's talk about something that sort of does and sort of doesn't get attention, and that's low-dose Naltrexone. I think it's second line for Actos. I start with Actos or Avandia first. Low-dose Naltrexone is a wonderful thing. We'll talk about how it works. I think it's very tricky to use, and I think you have to do it with the physician or someone very knowledgeable, because you can have problems with the dosing. Okay, where is this all working out? This has to do with endorphins, which is where the gluten-free, casein-free diet sort of, fits into the picture. Endorphins are those good brain chemicals that are small protein fragments in the brain. If you look at that little sort of sea green R there, that's the piece of the brain that responds to endorphins, and it makes you have good ambition for life, and you're happy, and you also can talk properly and have correct interactions with people. That it turns out that endorphins are all over the body, and they help the immune system too. If you have low endorphins, then you don't have enough of that, and your immune system doesn't work well, you're not on your game, and so on and so forth. It turns out that the endorphins come along and plug in, like that yellow E, and turn on that receptor and make those things happen. Naltrexone actually blocks that and stops that from happening, and you'd think we wouldn't want to stop that from happening. But let's think about things. When your kid's on the GFCF diet, we were worried that they're getting these bad endorphin-like substances that are from gluten and casein, okay? And so from those dairy and wheat products in the body, once they enter, they mess with endorphins, okay? And they do the same thing on these receptors. They turn those receptors, but they turn them the wrong way. They may turn them off when they're supposed to be on, or they may make them too on. And what's too on? Stimming on a ball. Okay, all the kids got their balloon or their ball at the party, but, my little Daniel sometimes, had just stimmed on it and not let it go and wants to take it to bed, take it to the therapist tomorrow, take it to dinner all week, and now let it go. That's too much. They want something too much. And then turning things off, sleepy. And what if that happens in your GI tract? Constipated, okay, slow down. Weak immune system, infections, autoimmunity, allergy. That's what happens in these situations, okay? And it's that same Th2, Th1 issue, all right? And then at the bottom, all these other illnesses that are driven by the immune system, okay? Inflammatory bowel disease, rheumatoid arthritis, asthma, lupus, okay? HIV, obviously, is something with the immune system. Okay, what if we give a low dose and block that receptor for a little period of time? The body says, I don't like this, okay? And it tries to make more endorphins. That's the idea behind this. And that just is a phenomenon that can happen in the body, okay? And so the idea is if we give a little bit, just enough to make the body say, hey, I want to make more endorphins to sort of compete with this Naltrexone, and we give a small enough amount, a low dose, so that when that low dose wears off in a couple hours, if it's low enough to do all that, and that's where the trick is, okay, because it's different for every child, okay? And Angie will talk to you about receptors. She loves receptors and viruses, and she'll talk to you about those things sometime if you get time to discuss things with her. And you can figure out what happens. If you overshoot, okay, and block that receptor too much, then the endorphins can't work no matter how much your body makes. But if it's just right, and you just tweak that and tease that receptor a little bit, and the body makes huge amounts of the endorphins, then you can have good cognitive effects, GI effects, and immune effects. What's that? Oh yeah, and Angie was discussing how that happens with other drugs with receptors, like Clomid for fertility issues.
Did any of you guys ever have any experience with Clomid, when you're trying to conceive? You know how Clomid works? And it goes in and tricks the body into thinking it doesn't have enough estrogen, because a lot of these women are low in estrogen. So it tricks the women's body into thinking that it doesn't have estrogen, so that the body will overproduce it. And if it works perfectly, they're able to have a good cycle that way. And LDN kind of works in that same fashion. You don't want the body to produce too much estrogen because it'll have negative side effects. But if you can get it just the right way, you can have some really good outcomes. That's kind of how that works.
And that's what we want to do. We want to find that perfect dose for your child. There are a couple of two different preparations. Oral, which in the real constipated GI kid, the constipated child, sometimes that direct application of it by taking it oral is really a good thing. If the kids have cramps or pain, or if they have constipation, because one other thing the endorphins do is they help prevent pain. And that's why you take things like morphine, which works on the endorphin receptors. So sometimes you get the kids to rise their endorphins. They have less pain in their GI tract. It's kind of nice if you do this orally. Most kids hate the taste of this, so it's very bitter unless they swallow capsules. So there is a transdermal form, okay? It's got to be given at night which is a pain in the neck about LDN, because that's when this cycle of tweaking and pouring out endorphins happens. And so that's sort of an inconvenience. Sometimes you're dragging dog tired at the end of the day. Not that, any of us spectrum parents, my son's got autism, would know about that. But then, you get, Daniel to bed, and then you fall asleep and you forget, and then you wake up and it's 1 o'clock. Is it too late, to give it? So it's kind of a headache. But anything after 8:30 is fine with me. And so if you have a diarrheal child, though, I would definitely not do it orally. I would do it transdermal. What about the child that's not on the GFCF diet? And you give them naltrexone, okay? Then their endorphins rise, and then there's more endorphins to compete with the gluten and the casein fragments, okay? Because they all try to fight for that C-green receptor. Then all of a sudden, the gluten casein fragments that are doing bad things get blocked, and you're suddenly, as if you suddenly put your kid on a cold turkey GFCF diet. We've had kids that have had sudden withdrawal. If you've ever kind of investigated that or did that with your own child, it's like putting your child in a drug withdrawal if you do the diet too fast. Naltrexone can have that problem. Furthermore, if you start off on naltrexone and you're not on the diet, and you got the right dose, and you work through all this, and what a headache, and we beat ourselves against the wall for weeks, and we got the right dose with Dr. DeMio and Angie, isn't this great? And we went through hell and back, pardon me, and then you go on the diet, it completely changes the dose sometimes of the amount that you need, because all these competing factors are at a different ratcheted amount, and it's very, very, very tricky, okay? It really, really is. It does some wonderful things, okay, but it can be very tricky. What are the good things? We want the 2 Bs, okay? If you're ever kind of up to your you-know-what in alligators and you wonder, how do I assess what it is that I'm looking for? The 2 Bs, the brain and the bowels, right? How's my kid's language? What's their behavior like? Are we getting good school reports? And how's their, eating, digestion, GI function, that kind of thing? Where are they at with that? That and the immune system in terms of obvious things like allergy and the amount of infections they get, and then those quote-unquote subtle things like these brain viral loads that we think are there. We want those things to improve directly clinically with your child. They should get better, okay? What about the side effects where they're in the same situations, the same areas of the body? So if your child gets constipated, if they start to have worse behavior that just keeps getting worse and worse or doesn't turn around, okay, especially if there's not a reason to believe that they're fighting an infection like a little bit of fever or something like that. If we think that it's just turning their brain endorphins the wrong way because you overshot the amount, because it's tricky, we start at a low dose and go up, then basically Houston, we have a problem, or whatever, that's when you call me. Now, we've had 2 kids, and this is what gives me really concern about LDN. Sometimes if you do overshoot that dose and your immune system gets weaker because you're blocking the endorphins continually, it's tricky, then the brain viruses, we've seen them, I think they've taken off twice in kids. And it's particularly kids that have high manganese, and there's a connection with that, and Parkinsonism and brain viruses, and the kids get tremorous. And we've had 1 girl that took 8 months to get over that side effect when I stopped the LDN. 8 months. How would you like to have that problem? You wouldn't. So it's like any other drug. It has its side effects. When it works, it's wonderful. But when it doesn't, it's a problem. We have to be very careful. So I developed an ultra-low dose protocol where you start so low that you sometimes put a little wisp of this on the skin that you can barely see and go up, and nothing happens in the beginning, and then you go and find the dose like a limbo game kind of going up.